next week due to finals. So I'll start with some announcements. First is the Luskin interest form. If you guys are interested in volunteering at Luskin starting June 20th, please make sure to fill out the interest form by this Thursday at 11:59. Um, I did send another interest form earlier in the quarter, but that form has the wrong orientation dates. So please, if you did fill that interest form out, please make sure to fill this new interest form with the correct orientation dates. Okay, and some of the roles that Luskin volunteers do is helping with check-ins, assisting in playroom activities, restocking supplies in hospital rooms, and helping guide families through the clinic. So if you guys are interested in volunteering, please fill out the interest form by this Thursday, like I said, because we are planning to send a final list of volunteers to Luskin on Friday.
Hi everyone. And then obviously tomorrow is our Pie in the Face fundraiser. So we still have some more spots available. If you're worried about being pied, don't worry, it's gonna be very clean. We're gonna have trash bags so your clothes won't get dirty and then hair nets. And you'll be perfectly fine to continue through your day, if you're worried about that. Um, so yeah, there's still a few more spots. We do need help cleaning up, so if people could sign up for that, that would be really, really appreciated. It's gonna be from 9:30 to 3:30, including cleanup, and setting up. So if you're interested, then definitely sign up. And if you're looking for extra points, you can sign up for multiple shifts, to try to build up your points. I'm not 100% sure how caught up our point tracker is, but hopefully we'll have that updated really soon. But you should probably be able to know like if you've been to however many meetings, because our meetings is 20 points and then fundraisers is 15 um, points each shift, and then social is 10. So you can probably kind of figure out how many points you have from that. Um, so yeah, definitely sign up for more shifts if you're able to, and we're really excited. We're going to be on Broome Plaza in the stage area. You'll probably see us. So yeah, also make sure to donate, and we're really excited. So hopefully we'll see you guys tomorrow there. And then tomorrow we're going to be having the Dockweiler Beach Social. Or not tomorrow, I mean Friday, at 6. So we have the sign up sheet there. We're gonna have 3 cars, free for transportation. So if you're looking for transportation, definitely sign up quickly because one car is already full and then one's already half full. So definitely sign up now if you're looking for transportation. It's going to be 10 points for attending. We're going to have pizza, s'mores, hot dogs, chips, soda, um, games. Feel free to wear a swimsuit if you're interested. Yeah, it's going to be really fun. So definitely make sure to come. Yeah. And I think we'll probably, since we're hoping to meet there at 6, we'll probably make sure to like take into account that we're probably going to be leaving like an hour early, like from each car. And then we have Uber splitting options too, but you guys will have to coordinate with each other. We're not going to be like checking or paying for the Ubers. So if you don't get in one of the first uh 3 cars, then yeah, unfortunately, it is like kind of a long trip, so it could be like 15, $20 per person. I'm not exactly sure how the Uber splitting will go. But yeah, so just to think about that. But yeah, we also hope we see you guys there because it's gonna be our last thing for the quarter. So yeah.
Okay, now we'll move on to a presentation that was organized by our lovely Advocacy and Awareness Director and also our Volunteer Partnership Director. So they'll introduce themselves now and begin their presentation.
Perfect. Hi guys. Let me just share my screen real quickly. Okay, so hi everyone, and thank you for joining us today. My name is Emily, and I'm the director for Advocacy and Awareness.
And my name's America. I'm the volunteer partnership director.
Today we're presenting a petition proposal titled Equitable Pediatric Care, a proposal for school-based health access. This initiative directly aligns with our mission as a pediatric club to promote the health and well-being of children both now and in our future careers. Many of us are pursuing careers in the healthcare and with a particular interest in pediatrics. That's why it's so important for us to start thinking now about how we can improve access to care and address the health disparities that many children face every day. We're calling on schools and policymakers to mandate a policy that ensures that all children receive essential care by mandating in-school annual physicals and expanding mental health support on campus. The goal is simple: to make essential healthcare accessible to every child, regardless of income, insurance, or zip code. We believe that every child deserves basic, essential medical care and mental health support, and schools are one of the most powerful access points to make that happen. So why does this matter? Too many kids are missing basic checkups, things like annual physicals, vaccinations, or developmental screenings. This disproportionately affects low-income and minority communities. In fact, low-income children are nearly twice as likely to miss annual checkups, according to the National Survey of Children's Health. When children miss these visits, we miss early signs of issues like asthma, diabetes, or developmental delays. This can lead to delayed diagnosis, more emergency room visits, and worsening long-term health outcomes. But this is not a problem that is only affecting physical health, it's also affecting mental health. We are currently in a mental health crisis that is especially affecting the youth. In 2021, 42% of high school students reported feeling persistently sad or hopeless. Yet, despite the growing need, schools are still lacking in necessary resources. The average school has 408 students per counselor, far exceeding the recommended 250 to 1 ratio. Students need more support, and schools aren't currently equipped to meet the demand. Mental health issues often begin young, which is why schools are such an important place for early intervention. Now let's talk about the barriers. First is cost. Many families, especially those that are low income or undocumented, may lack consistent health insurance coverage. Some children may remain uninsured due to eligibility issues, paperwork barriers, or lapses in coverage. The other issue is transportation. Not every family can get to a clinic, especially in rural or undeserved areas. And lastly is time. Many parents work hourly or multiple jobs, making it difficult to take pay time off. This means that taking a child to a doctor could mean lost wages or risking job stability. These obstacles add up, and children's health suffers as a result. The good news, though, is that schools already play a key role in the healthcare that we can then build upon. Many of us probably remember getting vision and hearing tests at school growing up. These are standard screenings that most public schools provide at specific grade levels, usually as part of a state mandate. The goal is to catch potential issues early before they interfere with students' ability to learn. In some urban or undeserved communities, mobile clinics already visit campuses to provide basic checkups and vaccinations. What we're proposing is to expand on this existing infrastructure, making school-based healthcare more routine, more accessible, and especially more available in high-need areas where children often go without care.
So how exactly are we going to do this? Uh, One of the things that I came up with was mobile clinics. So we propose to ensure that everyone has healthcare access regardless if they have insurance and their socioeconomic status. We want to mandate school-based annual physicals for all students of all ages that include hearing and vision tests. We also want to expand funding funding for counselors and social workers or telehealth supports in schools, because like how we mentioned, sometimes it is factor of parents not even being able to take the day off and take their kids to the doctors. So how exactly would we work? Us as a club, we can plan and promote this. We can partner with schools and communities, and as a group, figure out dates, post flyers, and send reminders through messages to parents and schools. And also as a club, volunteer, find a mobile clinic, um, and set up private exam days and deliver free physical, will help deliver free physical vaccines, vision, hearing checks, and even health educations. We can also do that with pamphlets. So that's something we can work as a club to try to educate um, everyone, especially those who can't receive healthcare. A third set would work with our volunteer team, which would be our clubs, members from our clubs. So our members and other campus pre-health club, we can pledge to help and help grief families and guide them into their van, tell them what to expect, help them fill out forms, provide translation and peer-to-peer health info, which is very important because a lot of the times uh, it could be that the adult doesn't know how to read English or vice versa. And it would be great that if we had people that also need other languages and help them out. Then we would collect also feedback and even more petition signatures. And the feedback would be very important in order to improve and be better volunteers and also track and follow up. So this is very important. So record visits in a HIPAA secure system on the spot and push automatic reminders for follow-ups and referrals to partner clinics or telehealth. So why school-based health centers matters. Students who use them attend 5.4 more school days per year, improved early detection of health or developmental issues, and it reduces health disparities in low-income communities, and it also helps students academic performance and attendance. So to conclude, many children in our communities, like low-income communities, uh, miss basic physical checkups due to cost, the lack of insurance, or parents' work schedule, or their inability to even take a day off or to afford to take a day off. At the same time, schools are overwhelmed by growing mental health needs, but also don't have enough trained staff or support system. And as a club, we should help students bridge this gap by advocating for in-school physicals and strengthening mental health support. So yeah, here's our QR code to sign our petition.
It is free to sign, and please share it to all your guys' friends and family so that we could get more people to sign it and make more people aware of this. And if you have any questions, feel free to type into the chat box or to unmute yourself right now.
Do we have any questions? If there are no questions, we'll share this petition in our Discord. And like Emily said, please share this petition to all your family members, your friends, so we can really spread this goal and message to many people so we can really make an impact as a club and as a community. And thank you guys for listening. Thank you to Emily and America for um, organizing this presentation. And we will share the sign-in form. If Emily, do you want to stop sharing? You can put the petition in the chat. So this is our sign-in form. Make sure you guys sign in so we take attendance for today. Thank you guys. If you guys have any questions regarding club logistics, you can also stay behind and ask us. I know it's like towards the end of the quarter. So if you guys have any questions, you can stay behind, ask, or email us.